just a matter of luck now, honey. Plenty of cake for everyone, you said.
Hey, Jen.
Try to get out of bed. With lines on my face, I'm such a disgrace, oh yeah. Tried to contain it, I didn't mean to start a war. You can point your pistol at me, but I'm the quicker draw. Nah, nah, nah. Who's gonna feed me? Now I've broken all the plates. Who's gonna love me? Who's gonna love me? I am all the mess. I am all the mess. I am all
Hello, Shawn. Hi, Sarah. Hey, it's okay. Come.
But I think talking
Hey, it's showtime. It's not bark time.
to artificial
Come
face
here. Come. Come on.
slightly
Rocky says hello.
populating.
Let it run out the door.
Hey, Kathleen.
Spray it on all of the walls.
So you guys are listening to my new single. It's called The Mess. It's all about anxiety and depression talking to each other.
Anymore.
I'm sure a lot of people can relate right now. 2020 is a bit of a mess. So we're here to gather and to talk about mental health this week. It's Mental Illness Awareness Week. And this is our way of educating, gathering virtually.
Can anybody save us?
Hello, Mama. Tonight we have a really interesting show. We're talking to Shawn Secours, who is a therapist, has worked a long time in addictions and also in emotions and mental illness. And so we are going to be talking about some pretty deep subjects, and I hope you can relate. I hope you get something out of it. I am all the mess. We are all the mess. But hey, we are in it together, and here we are. So without further ado, I am going to tap Shawn in, and we're going to start our conversation. Shawn is from Cornwall, Ontario, and it's always nice to showcase people doing interesting things in Cornwall and surrounding area, because it is a beautiful city, and I do love this city. And here we are. Hello, Shawn. Comment ça va?
Ça va bien, toi?
Ça va bien. Thanks for being with us today.
Thanks for having me.
It's nice to see you.
Yeah, it's been a while for sure.
It's been a long time. I was trying to figure out, like, we didn't go to high school together. We went to elementary school together, didn't we?
Went to elementary school, but I think we maybe a few years in high school. I went to St. Joe's at the end for a couple of years.
Yeah, okay. That's why in my mind I was like, but I remember you as a teenager as well. Yeah.
Had a bit more hair then. But.
Oh, geez. You can have some of mine.
Yeah.
So, Shawn, tell us a little bit about I guess your career in mental health so far.
Sure. Well, I guess it started quite a while ago. I started in group homes, really whenever I was kind of green out of school. Did that for a couple of years, and then an opportunity came up with Addiction Services. It was called ASEO at the time, so Addiction Services Eastern Ontario. Really didn't think that I would get it. Didn't really have any experience other than kind of personal experience, but really nothing professional. So I applied, and I ended up getting the job. And I worked there for 12 and a half years, just recently switched to adult mental health. It's still part of the same, I guess, agency. We're all part of the hospital now. So the hospital kind of amalgamated everybody. So the idea, it's been a big push, I think, throughout Canada, throughout Ontario, to treat things concurrently. So at the same time, mental health and addictions, instead of in silos, which is what it was before. So I'm still in the same agency. I just kind of swap programs.
Right.
I guess.
Right, cool. And so, I mean, what's the difference between what you were doing before, where it was like specifically addictions, and now
Mhm.
working with adult mental health? Are there similarities? Are there
Mhm.
differences?
Yeah. There's both. For the similarities, I guess we used to. I say we, my colleagues and I guess other people in the field often would say that it's kind of a chicken or the egg, right? What kind of came first? Is it mental health? Is it substance use? Because oftentimes they both present. Um, and it's really hard to tell. And I don't think it makes that much of a difference. I mean, sometimes substance use can mimic or cause mental health issues or mental illness, and sometimes it's the inverse, right? I might have some mental health issues, and then I find that whenever I use certain substances, I feel a little bit better. So when I worked with addiction services, I dealt with both. And I think most addiction workers, addiction counselors, addiction therapists probably say the same thing, that you're treating it kind of concurrently. So I think that really prepared me for my new role. And now I guess I still see some substance use in the clients that I'm working with. It's much less the focus of conversation. It does come up sometimes. Maybe my ears just a little bit more tuned to it, so I tend to pick that up a little bit more.
Right.
But the big difference is now for me is I used to talk every day about substance use, whereas now it's every day. It's about mental health, and there's a wide variety of topics, I guess, there that present themselves to our agency.
Right. And last night we had a little pre-chat, and you were
Mhm.
talking about a specific therapy that you are like, there's only a few of you trained to do this. Do you want to talk about that for a minute?
Sure. Well, a few of us at our agency, and that's starting to grow. It started with four of us. It's at our agency, anyways. It started with four of us. It's called DBT, Dialectical Behavior Therapy. It was originally put together by Dr. Marsha Linehan, who was somebody who struggles with BPD symptoms herself and has the diagnosis as well. And I think she just struggled with that for a very long time and then tried to understand it. And she did that through Zen meditation and Buddhism, and then through just a bunch of different therapies, and then put it all together and created this DBT program. Um, so there was four of us that went over to get trained by the Line of Hand Institute, and we've been doing that since for about 5 years. Now our team is pretty big, so that's where DBT is a bit different. Is instead of being one-on-one all the time, it's really a team approach. So we have a team that meets every week. We each have our own clients, and we each work together to help us address the needs of these clients, because it's usually very highly suicidal individuals, people who maybe treatment or therapy didn't work for them in the past, kind of felt stuck. And this therapy and this model is really designed to help that out. Now, we've modified it a little bit because we can't, we're not a private agency, I guess, in a sense. So there's some workarounds that we had to do for around phone coaching, which is a big part of it in the States or other places, where clients, if they're going through their day-to-day life and they feel like they don't know what to do, they'd be able to give us a call and we would help them in that moment. We just can't do that. So we use the crisis team with that. We got creative with it and kind of asked our trainers if that'd be okay. And they said, yeah, it's still comprehensive DBT. So it's just a little bit different.
Right.
Still
So
works.
for someone to end up in your office or on a phone call with you, what are the symptoms? What's the path to get to you to get to dialectical behavioral therapy? Did I say it right?
Sure. Yep. Yeah. Well, I mean, I can answer that in a couple ways. I mean, to get to me or to any other counselors or therapists in the building is pretty easy. If anybody's experiencing any kind of discomfort, whether it's because of substance use, mental health, or it's that of a friend or a family member, they could just give our agency a call, give the hospital a call, and just say that you're interested in speaking with somebody. You would then be set up with an intake worker. They would kind of walk you through some basic questions. It would probably take about 40 minutes or an hour or so. And then they would set you up with the most appropriate service. So that's probably the best way to get your foot in the door. If you're looking for DBT specifically, I mean, we've had doctors put in referrals, psychiatrists, people themselves. Still, it's got to come through that regular route where they're going to be assigned to a therapist, and then the therapist will kind of decide whether it's an appropriate referral or not. Because DBT is a big program.
Right.
You can kind of think of it, maybe it's not the best metaphor, but like a nuclear bomb, and maybe you don't need that, right? And maybe you just need pieces of it. Maybe you don't need the full, 6-month program, or, we used to do it in a year, because it's 2 hours a group a week, 1 hour of individual therapy, plus you get the phone coaching, plus, for 6 months ongoing. And it's got to be high commitment. There's a lot of homework and practice in there. Sometimes you don't need that, but sometimes you do.
Yeah, right. And so what are some of the exercises that you might take someone through doing DBT?
Oh, all kinds. I actually believe, since I've learned about DBT and the skills, I think that this is just something that's good in general. I think it would be good if it was taught in schools. I've heard other people say the same thing. I don't know if that'll ever happen. It's like a collection of 28 essential skills to be effective in your life. I really don't think that you have to be somebody who experiences severe dysregulation to benefit from these skills. Since I've learned about them, I use the majority of them as often as I can. I mean, it's communication skills, it's emotion regulation skills. So how to either increase the frequency of certain emotions that you want to experience more, or decrease the ones that are leading you to be ineffective. How to tolerate distress. So not solve the problems, but just get through it without making the situation worse. Sometimes we put our foot in our mouth type of thing. How to avoid doing that, so that you can allow the emotion to come down and then be more effective in your decision making. The whole background around that is that if you're somebody who struggles with emotion dysregulation, there's a number of things that are kind of happening. Part of it is biological, just the way people are wired, right? You might experience emotions a little bit more intensely than other people. They might come out of the blue. You don't really know why you're feeling a certain way sometimes, and just kind of hit you like a ton of bricks. Or they might take a little bit longer before they come down. Right. That's the biological side, right? Or maybe you're a bit more impulsive. But there's also a social bit that goes with it as well. So it's not really something that you're born with. You're born with that kind of blueprint, but then there's this kind of perfect storm that can happen with an invalidating environment, right? So if you grow up a lot with, and it's not the environment's fault. The environment's trying the best that they can, right? Parenting doesn't come with a manual, and sometimes people just don't know how to, address certain situations. I know I've heard it growing up. I know a lot of people have heard things like, why are you saying that? Why are you feeling that way? If I hear that over and over, I might start to question my emotions. Right. And I might not be able to get my needs met. So I might actually have to pull the fire alarm, so to speak, to get my needs met. And then if that works, maybe I fall into that habit. So what DBT does is it helps kind of slow that process down for people, and then give them the skills to be effective. So the skill deficit gets replaced. So. Right.
That's interesting. It makes me wonder if there are any sort of resources online that people can do without having to see a therapist. I mean, you told us the best way for that route is maybe to go to the hospital and be referred, or speak to your doctor about this. But if somebody isn't in the absolute depths of it, but still wants to learn about how they can manage their own emotions, are there any resources online that they can look up for DBT?
Yeah, there definitely are. So DBT as a whole, like I said, would be more of I don't know, it's like a bunch of different moving parts that together make up DBT. The individual parts themselves could be what we call like DBT informed. It could be parts of DBT. On its own, it won't be dialectical behavior therapy, but it'll have elements of it. That stuff for sure you can find. You can get books on it. I mean, if you were to Google DBT, you're going to find tons of stuff. If you were to YouTube Marsha Linehan, she's the founder, or go to the Linehan Institute, there's a webpage there. They have all kinds of trainings now. I mean, those are big trainings and probably cost a pretty penny. But if you just go on YouTube, you're going to find tons of stuff. Pinterest has tons of resources actually for DBT as well too, because it's something that's, I think, worldwide, definitely throughout North America, Australia, in Europe. And there's lots of people that have benefited from this therapy, and people are pretty creative, so they put their own stuff out there. And you can find it. There's lots of podcasts, lots of Instagram pages. I mean, there's tons of stuff. You got to kind of filter what you're looking at, but there's some good stuff out there if you just hit Google up.
Yeah, I feel like that's good advice with any sort of like mental health research, and what fits with you is like you got to filter some stuff out. You got to take what works for you and leave what doesn't.
Yeah, absolutely. And always be careful with your sources, right? I mean, the general public, like just in general, will have some good stuff, but I think you got to take that with a critical eye at times.
Right. Let's dig into addiction a little bit more, and maybe starting, I don't know if this is the beginning or not, but a question I had is, how do you know when something has become an addiction?
So there's definitely kind of the like more official kind of way that you can do that, right? The DSM-4 has got criteria that you could meet there. I saw that you shared something earlier by Gabor Mate. He's probably one of my favorite addiction, I guess, speakers and writers out there. He's got his own set as well of criteria. It's kind of 4 things. It depends what model you're following as well too. But basically, if there's a compulsion there, like a need, it's something that you want to engage with over and over. You're preoccupied with it. You're thinking about it a lot. If you experience kind of a loss of control over that behavior, where maybe you tell yourself like, I'm only going to have 1 drink this weekend, and then you end up having 2 or 3, and that happens regularly. Well, that's maybe something to kind of pay attention to there too. If you're unable to quit, even though there's reasons to quit that you're aware of, you keep telling you, I got to stop doing this, and you're having a hard time doing that. Well, that's another sign there too, because generally speaking, if something's hurting me, I can stop doing that pretty easily. But if there's a compulsion there, it becomes a little bit harder. I can justify it. I can say it's not so bad this time. And the more and more that happens, the more it starts leading towards maybe this is problematic. Maybe this is something that's getting in the way. Maybe it's misuse. I tend to stay away from the term addiction. Like a lot of things in mental health, things get stigmatized, right? Mm-hmm. And I really do think that the term addiction has been stigmatized. A lot of people over the years started feeling like it was a matter of willpower, just stop. And it's not as easy as that. Like, sure, that's the solution. I got to just stop. But how do I do that? And sometimes I want to stop and I want to keep using at the same time. So it's hard and it's demoralizing. But I think just looking at it as is it problematic or not in your life? And if it is, are you able to stop it? If not, well, there's a compulsion there, and there's definitely some things that you can do to help yourself out. And it's more than just willpower. I think that's a piece of it, but it's not the whole. It's not the whole show.
Right. You're having to dig perhaps past the symptom to see what's causing it underneath.
Yep. Absolutely. And it could take a while to do that, right? I mean, to figure out, why am I using that? We talked about that chicken or the egg, right? Sometimes it's because it's making me feel better on some level, or it has in the past and now it's not. Now maybe it's making symptoms a little bit worse. That tends to happen with substance use a lot, where at first it might help, and then down the road it could what we call exacerbate or make problems worse, I guess, over time. Because it's psychoactive, right? So it's kind of messing around with your wiring a bit, especially depending on ages. If you start in youth, way more likely to become a problem later on in life. It's just kind of messing with the wiring. When the wiring's set, well, it's primed for substance use instead of something else. So right. It becomes harder to change at that point.
Right. An interesting thing that I heard Gabor Mate say once was that, and I'm paraphrasing, but the addictions or compulsions in that sort of way, in a self-medicating way, are often due to the want for connection. What are your thoughts on that?
Yeah, definitely. There's so much that we can get into with that. So for sure, one common thing that I see a lot, I worked with a lot of teenagers whenever I was working with addiction services. I was in the high schools very often. Um, and I mean, through my own personal experiences with high school as well, and with friends of mine too, it's a very easy way to make friends. If you don't have any other way, or you're not comfortable with any other way, maybe you're too shy, maybe you're anxious around other people, you have nothing in common with them. Well, it's a very easy way to just jump into a circle of people and have something in common. And then that can quickly slip out of control. Then you can get into the whole discussion of AA is very big with this. So Alcoholics Anonymous, in the big book, it would talk about filling a spiritual need or a spiritual void. There may be that level of connection there as well too, that there's just something empty and we're looking to fill it with something. That maybe isn't the most effective thing to fill it with. And then it could become pretty hard to change that, right? As that dependence and desire for it kind of grows.
Right. How important is it, do you think, to have a sponsor or to have a therapist or to have somebody helping you through perhaps an addiction rather than going it on your own?
I think that's probably different for everybody. I honestly believe that there's a lot of people who do it on their own and succeed. There's probably a lot of people who try it on their own and can't succeed. Or struggle with it, and kind of come back and forth. One of the things that's common with substance use and mental health as well too is like a return to use or a return to symptoms. Relapse, I guess, would be the common term there too. So I think, yes, it's definitely good if it's something that you're struggling with. Whether you're getting yourself a support, a best friend, a family member, a stranger, a pastor, whoever you can connect with. And that may be a therapist, that may be a psychologist, you may be your doctor, it could be your neighbor. I don't think it matters so much on who it is, just as long as you have that connection. I heard you talk about that yesterday, actually, in your live yesterday, having a connection with whoever it is that you're working with. I think that that's one of the most important things. And then there's are they able to actually help you as well too. So I think it's important if you can't do it on your own, and most of us can't carry the weight of the world on our own shoulders. So it's probably good to do. I mean, even therapists get therapists. So I mean, it's just a healthy thing to do. It's good to be able to bounce things off of people.
I've often wondered why we don't. Who knows what's going to happen in the future, but you're born into the world, you have a pediatrician, you have somebody who's checking up on you. I am waiting for the day where we are, assigned, if you will, a mental health expert to help us out through our lives.
Yeah, that'd be cool.
That would be cool.
Yeah, absolutely. Yeah, I mean, there's so many systemic things and barriers in the way, right? There's different lenses that people view what's needed in the world and what's not needed, right? Whether we value money over our own mental health. I mean, I know what I feel is right, but I've also heard the other side of it, that other people value other things more. And I think that that's just the reality that we're in, is that we're living in a massive world with a lot of different needs. And someone's picking and choosing what we do, and that changes every so often. So hopefully hopefully at some point it goes back towards, building that infrastructure to be stronger. Right.
We've got a question here. It says, what are the resources? Well, first of all, she's saying, loving the interview. Thank you, Maddie. What are the resources out there to help family and friends of someone suffering from multiple addictions or substance use?
It's a great question. I mean, depending on where you are, I mean, if you're local to Cornwall, you could definitely call the hospital or the Center for Addiction and Mental Health, which is just next to the hospital. You can call either number. It's the same agency at the end of the day, so they can get to the same help. Even
if you're not having substance abuse problems, but someone that you love.
Yes,
right.
Absolutely. It's such a big thing, right? If it's environmental, right? It impacts other people. If I have a substance use problem, it's not just going to be me that suffers from it. It's going to be those people near and dear as well too. It's going to be the people that care about me. Even if I'm pushing them away, they're going to be suffering from that as well too. So at Addiction Services, I know for quite a while they've been offering, and they still do, services to loved ones, family members, children, parents, whoever it is. You can get your own counselor, you can get your own therapist to work on some things. There's groups as well. And then once kind of that work may come to like its natural end, there's other services to be plugged into as well too. There's a lot of community like AA. So there's oh geez, it's escaping me right now, but there's AA for family members. I don't know why I can't think of the term right now, but they have their own.
Is it one is Al-Anon?
Al-Anon, there you go.
AA? Yeah.
Yeah, so there's Al-Anon. There's also Smart Recovery, which is a science-based, instead of like faith, 12-step based substance use program that's based on cognitive behavior therapy. And they have a family program as well too. These are all accessible online, especially during the COVID times. Everything kind of, I guess, developed online capacity. We have that as well too. We can offer Zoom. We have the family group available on the Cornwall Community Hospital website. You can go to the addiction services section. You can see at the bottom that there's a YouTube link there. You can listen to it in French or in English. If you'd rather do that in person, right now it's offered through Zoom, but that's something that you could do. You just call the agency, do your intake, say you're interested as a family member or a caregiver, and they can set you up with that as well. And we have peer support and family peer support as well too. So there's lots of resources there. If you're in a community outside of Cornwall, I'm very confident in saying they have very similar programming. We're not the first ones to be doing this. It's out there. And if people are really curious, you can always take a look at stuff called CRAFT. It's an approach for family and substance use. I'm sure you can find that on Amazon or find some workbooks there as well too, or just Smart Recovery for Family.
Right, nice one. Yeah, and perhaps on anyone's local hospital website, they'd have this information too, right?
Yeah, the bonus of all the hospital stuff is it's all covered by OHIP, so it's not going to cost you a cent. I know in Cornwall, there's no wait list. There hasn't been a wait list for a very, very long time. Very quick to get picked up. You can go private. You'll pay a little bit. Some places might be sliding scales. You might have EAP, so employee access to providers. Maybe 5 sessions or so seems to be the usual that they'll pay if you have that through your benefits. That's another option.
Right, and Al-Anon and AA are free meetings that you can go to. What was the name of the other one? The science-based one you said? Smart Recovery. That's another free sort of group setting. I'm sure they're doing a lot of stuff online at the moment.
Absolutely.
I was going to ask you about specifically about addiction in the time of COVID right now. Are you seeing case numbers rise? Are you on a wait list? Are you tapped out? Do we have enough people taking care of our community in this way?
So I'm a little bit removed from that right now. I mean, I was working with addictions at the start of COVID. For the past 2-3 months, I've switched over to adult mental health. I mean, I still work pretty closely. They're just down the hall, and I see them very often. So there still is no wait list as far as I know. So it's still a very quick, you're quick to get picked up, about a week to get your intake done or 2. And then you're usually assigned the following week. So within a month, you're seeing your therapist or your counselor, and you're working on things. I would say it was interesting when it first hit, and I don't know if this was common across services, but engagement dropped at first. I think people just weren't sure what to do.
Right.
So sessions were very short. People weren't used to doing sessions on the phone. We didn't have Zoom yet. Slowly as the months went on, then the need started to increase again. If anything, I'd say we're back to normal, and maybe slightly over that in some ways, because we're offering services now in multi ways, right? I mean, there's Zoom, there's phone, and there's in person that we can offer now. Before it was all in person. So if you were someone who's anxious or didn't feel like going out today, you didn't come to your appointment. And eventually maybe your file will get closed. Now you could just say, you know what, let's do a phone appointment. Let's do a Zoom appointment. So I feel like we're actually reaching more people now. And I think this will stick. I think even if it goes back to, hey, everyone's back to the old normal, I really think a lot of agencies are going to be keeping Zoom. They're going to be keeping phone sessions because it seems to be just as effective. And lots of research is coming out pointing in that direction right now.
Yeah,
So
yeah. This has come up, I think, in every interview we've had this week, is that, like, you know, there is an opening for more people to possibly have access to the healthcare, the mental health care that they need, thanks to, you know, people making accommodations now where, you know, you don't have to necessarily find a way, you know, if you don't have a vehicle, if you don't have a transit card, if you have some sort of disability that, you know, gets in the way of you moving around, you can still kind of access from the comfort of your home.
Mm-hmm.
We talked really, really quickly yesterday about rehab and intervention, and something I was going to ask you, Shawn, is, like, you see these programs online, or sorry, programs on television, that sort of thing, that that maybe like sensationalize these sort of things. And, you know, like you had that program for a while, I don't even know if it's still running, called Intervention. And,
Mm-hmm.
you know, as much as people are maybe learning a little bit from shows like that, to me, it's kind of like, it's invasive for
Mm-hmm.
someone. It's looking down a little bit on people. What are your thoughts on shows and you know, and rehab things and all of this stuff that we see, like maybe the Hollywood version of that? What do you
Yeah.
think that does for people?
Oh, well, I think on the one hand, you're right, sensationalizes things. That's not to say that no one's learning anything. I do think some people are learning just by watching it, maybe learning a little bit about what it's like, what some people go through in terms of withdrawals or tough decisions. In terms of the individual that needs to make the change, it's a little bit harder. I think change typically has to come from inside of us. We've got to want it. That's not to say I can't change if someone kind of pushes me into it. I could make that choice of, you know what, I want to do that. And research did show that sometimes when people are forced through court mandates or whatever it may be, that change can happen. And we've seen that. We've had programs. Now it's called New Beginnings and Next Steps. It used to be called the mandated program. So that was people through court systems that are being told, go to addiction services. Well, generally when people come because of that, they're not happy. So we're not going to put them through regular therapy and regular counseling because there's no engagement there. It's not going to
Right.
work very well. So we designed a program that's very short, goes over the basics, and uses lots of motivational skills, motivational enhancement, gets them thinking a little bit, gives them a couple little tools. It's not really confrontational. And what we see is by the end of it, actually, some people want to continue on with therapy, whereas before they didn't want to. So being forced into treatment might lead to some change, but not always. So when it comes to shows like Intervention, and I think research would probably back this up, I haven't really looked at it very well, but it's probably not that effective overall. Maybe it is. Maybe I'd be surprised if I really looked at it, but my gut feeling's telling me that cornering someone and shaming them into change probably isn't the best way to do that. There's definitely more gentle and caring ways to do it that can work.
Right.
That have been shown to work.
And like you said, at the end of the day, the person in question, the person who is suffering from substance use, has to want to make those changes for themselves.
Yeah, change is hard. Like, how many people make New Year's resolutions and don't stick to them, right? I mean, change is hard just to begin with. If I'm going to change something that I'm addicted to, well, it's going to be just that much harder.
Right. Right. And like we said, and where is that coming from? You know, it might be coming out as substance abuse, but what is it that we're trying to pad, or what,
Hmm.
you know, the substance use can be like a soft place to land kind of thing for people. So what is it that's hard, that is difficult to look at within yourself?
Hmm.
Yeah,
No, absolutely. Like it's a complicated thing.
it
It's
is. It is.
not easy to make those changes.
No, people are complicated and beautiful and
Yep.
wild and amazing, and you're amazing. Thank you so much for being with us today.
Oh,
Um,
well, thanks for inviting me. I mean, I love doing this stuff. I get anxious about it. I had a hard time sleeping last night. But you know what? I love it, and I do live for this stuff. So it's just funny that I get anxious for it.
Yeah, I was anxious today too. I was like a little bit shaky, but you know, once we start, it's great, and I love doing
Absolutely.
these things, and I'm so glad that you've been on board. Last question for you, Shawn.
Sure.
When you come home from a hard day or you have a hard week of dealing with all of this stuff, how do you keep your own mind healthy?
All kinds of stuff. Like your guest said yesterday, I don't do it all the time. I definitely do have my days where I just come home and probably am not very skillful in how I do self-care, and just kind of, go to bed or shut down. But I think that that's probably important to recharge my battery as well. I like food. I'll eat food. I like music. I'll listen to music. I'll play games. I'll hang out with my family or just with people that, bring a smile to my face or make me happy. I'll also just go for a drive sometime or go for a walk. Uh, there's probably a million things I do for self-care. I'm like self-care ADD maybe.
That's not a bad thing, is it?
No, no, no. It's good because it's fresh every time. Just do something different.
Exactly. Shawn, thank you so much for talking to everybody today about your expertise in this matter, and thanks for being such a great support in the community of Cornwall. We appreciate you.
Thanks for having me. Hopefully, it was helpful for some people.
I
If
think
anybody
so.
has any questions, shoot me a DM.
Awesome. Awesome. Cool. Well, I'm going to let you go, Shawn. Thank you so much for being with me today.
Thank you.
Ciao.
Have a good night. Bye.
As I let Shawn go, I just want to thank everybody for watching. I didn't say this at the beginning, but I should have. If you're experiencing something that is urgent right now, this is obviously not a therapy session, but just a conversation. So going to your nearest hospital, talking to your doctor, Crisis Center Canada. There are other crisis centers around the world, and a quick Google search can help you with that. Thank you so much for watching again. This was the fourth, I think, fourth out of six. We have two more. Tomorrow is Friday. We're going to talk to Cindy Dwar, who is a singer-songwriter, bilingual, and is now doing a master's in arts counseling psychology. We're going to talk about the science behind different mental health issues, and so I'm really excited to get into the nitty gritty because I'm a bit of a science nerd myself. So we're going to dig into that tomorrow, and thanks for being with me. I hope you learned something today because I sure did. And thank you to Shawn for being with us. You guys are awesome. We are all the mess. I'm Melanie Brule. Thanks for being here with me. Ciao les amis.